Andrea Maxim, who is a naturopathic doctor. Good morning.
Thanks for having me.
And how are you today, Andrea?
Doing very well, keeping my health on track, and that's really what the goal is for all of my patients.
Yeah, exactly. And I find in this hot weather too, it seems harder for a lot of people to keep that on track.
It is,
yeah.
It is. And usually if we just stick to the basics, drinking lots of water and keeping cool, we can get through it quite easily.
Yeah, exactly. Now you have your own practice, I understand. She's in Caledonia, and you also work out of the Oakville region as well.
Yes.
Excellent. So that must keep you very busy.
Yeah.
So, Andrea, tell me, how do people choose a naturopathic doctor? Like, how did you get into this line of work yourself?
So we'll start with how I got into it. I always wanted to be a doctor ever since the age of 5, but I always wanted to be a doctor that could really sit down and talk to my patients, really understand where their complaints and their concerns were coming from, and really be able to develop a relationship with my patients. The knowledge that I gained as a naturopathic doctor has really allowed me to do that, as well as treat using diet and lifestyle recommendations, acupuncture, herbs. And with regards to finding a naturopathic doctor, what I recommend all of our viewers to do is to go to www.oand.org, which is the Ontario Association of Naturopathic Doctors, and it lists all of the licensed registered naturopaths in the area. And then you can find one close to you.
Yes, and hopefully that would be you.
Hopefully it would be me, yeah.
Yes. So what is the primary goal? What is the goal for a naturopathic?
So as a naturopathic doctor, it's our goal to not only address the symptoms that our patients are coming in with, but to determine why those symptoms have presented themselves. So we like to try to find the root cause of those issues. So I firmly believe that the body can heal itself in any means necessary, but if there's obstacles to cure, and what I mean by that is if our stress levels are really high, if we don't have enough nutrients, if we're eating foods that are causing inflammation in the body, if we don't remove those obstacles, the body's going to have a very difficult time getting back on track on its own. But by determining that root cause, generally our patients respond very quickly to treatment and usually have long-lasting health, and that's kind of the whole purpose.
Yeah, exactly. So do you find that you've gained patients where the conventional medicine fails them?
I do, and simply because we are offered the freedom to really sit with our patients for about 30 minutes to as much as 2 hours and address a lot of the questions that they have. Unfortunately, with conventional medicine, because they're so busy, they don't always have the time to sit down and talk to their patients. Naturopathic medicine has that opportunity to really answer questions and concerns and educate our patients on how the body works and what could potentially be going on. Once patients become empowered with their health, they're more likely to continue to achieve optimal health outside the clinic, and that's really what we want.
Okay, so when that first patient comes to you, what's the procedure when they first come to your office?
Yeah, so what we always ask our new patients to do is to fill out an intake form, and the intake form is detailed. It's about 4 pages long, but the reason why is because we need to get an entire view of how that person is presenting on that particular day, and then it allows our first appointment to go a lot more streamlined and start treatment right away. Our first visit is about an hour and a half or an hour long, depending on which clinic you go to, and that allows us to really get a relationship going and get a good treatment plan in place. And after that, it's about a half an hour visit at a time, and it's just follow-ups to make sure that the patients are understanding everything and everything's going well.
Okay, very good. So what tests then do you run when you're diagnosing a patient to choose the best treatment to assist them?
Now, I firmly believe that the more lab testing we do, the better I am at treating my patients, because I have a lot more data at my fingertips. We are actually able to requisition any lab work that a medical doctor can requisition, except patients will find that they're paying out of pocket for that because we're not covered under OHIP. But above and beyond that, we do food allergy testing, salivary hormone testing to make sure our hormones are in balance. We can test heavy metals in the hair. We can test for any infections that are going on. You name it. As long as it helps us get to our goal, we can do it.
Oh, fabulous. So what methods do you use then to treat your patients?
I find that for the most part, I stick to the basics. So if we can get people eating right, sleeping right, digesting right, pooping right, moving right, all those things, then the body will easily fall back into balance. If we don't address all of those basic components, it's going to be a lot harder for us to get where we want to go as quickly as we want to go. Because I always believe that patients want to get better yesterday.
Of course.
So I try to make that happen.
Yeah, and I think sometimes by the time they get to you, they are desperate because no one else has been able to give them those answers.
Absolutely.
But when people do come to you, what would be the most common ailments that a person would come to you for to be treated?
So for me specifically, I do a lot of hormone balancing, so I've been getting a lot of women with menopause and hot flashes. I've been getting some women coming in with fertility issues. I also treat a lot of digestive complaints because we're just not absorbing our foods as easily as we were a long time ago, and the soil is a lot different. And then I do treat pediatrics as well, so young kids with ADHD or autism. I've actually had a few Lyme disease cases recently, so it's been a huge variety of complaints that come in.
Wow. Well, I'm sure that, it sounds to me like your practice is growing and it's going to get even bigger because it seems where the conventional medicine doesn't have all the answers anymore to a lot of the things, and I find a lot of the things are very environmental. So that's wonderful. Andrea, thank you so much for coming into the studio and sharing this with me today. How can people contact you?
The best way to contact me is to visit my website, www.andreamaximnd.com, or you can call me at 1-888-375-3111.
That's good.
Thank you so much.
So if you have some questions and you'd like a naturopathic doctor to answer them, contact Andrea for some more information. Recovery plan in place.